folks, welcome back to the reading room. Wanted to talk today about this 12-year-old mixed breed dog that presents for vomiting. So we have a few abnormalities going on in these radiographs. Let's take a look. In the cranial abdomen, one of the first things that jumps out at me is this soft tissue opacity mass that is causing displacement of some of the intestines. So I'll draw on that for you, just kind of highlight where I'm seeing this mass. Round, soft tissue opacity that's displacing adjacent intestinal segments. It's a little bit challenging to see in the VD projection. I think that it's kind of living in this region over here. So what we need to try and do is figure out where this mass might be coming from and what sorts of things can live in that region. Well, we could have a renal mass in this location. However, we can see the kidney separately from this in this projection. So it's not that. It's also living a little bit too far ventrally in the lateral projection to be our kidneys, which live up here. So that kind of rules that out. What else can live there? Well, definitely pancreas could live there. However, typically pancreatic masses are going to sit between the stomach and the colon, cause displacement of those two things away from each other, which we're not seeing in this instance. To me, there are three major diagnoses for a mass that looks like this one, and we've ruled out those other two features. The first being maybe a splenic mass, so this could be part of the ventral extremity of the spleen that's sitting up a little bit dorsally, causing displacement. Another being a hepatic mass, which is actually what it is in this instance. This is a hepatic mass extending caudally here. Or there could be lymphadenopathy in the cranial abdomen, something like a jejunal or mesenteric lymph node that's become enlarged and causes this mass effect to be present. So once again, what we're identifying is this round, soft tissue opacity mass that is causing displacement of adjacent structures, and this is an example of a hepatic mass in this instance. Though we can't know that definitively from radiographs, we need an additional test like an ultrasound or maybe a CT to definitely tell us. The last thing that I wanted to take a look at, of course, is this thing that was probably jumping out at everyone as I was going on about the mass. This, of course, is a urinary calculus. Pretty easy to see in that lateral projection, a little bit more challenging in the VD projection, sitting right over here. So those are the findings in this patient. We've got a hepatic mass and a large urinary calculi, and this patient ended up going to surgery for removal of that mass and a cystotomy and did quite well. So I hope this has been helpful, and thanks for joining me.